Okay, pleasant good morning to everyone. Right, so this particular live is actually going to be on joint pains, and we're going to just narrow into the knee pains at the moment, right? So I'm just going to wait for the live to build up a bit, and then we'll continue this program today. Now, for those that are joining us for the first time, okay, let's see. Let me just put up some banners. Okay, pleasant good morning again to those that are now joining. Now, if you have any particular questions or query that you'd like to get answers to, health questions, feel free to ask as we go along. All right, so this program, it's on joint pains, and we're going to be going through some information how to deal with, right? So we're going to start off with the knee, because I think that is like a common thing that generally happens to most persons. So knee pains, many persons will be dealing with knee pains. Now, you're looking at the function and how to get rid of things like inflammation. All right, so now you'll see the normal knee. Okay, so I'm just gonna maybe take like 2 minutes and let the live build up a bit, and then we'll continue. All right, so there's 2 minutes. Those that are watching, if you have any particular questions that you'd like to ask, you can send in your questions as of now. All right, so I'm just letting the live build up a bit, and then we will continue this program. So if you have any particular questions, feel free to ask as we go. Knees, how important are knees? Of course, without knees, we can't move, we can't sit, we can't really bend properly. So you need to have healthy knees in order to walk properly. So if you look at the normal knee, right? So normal knee, you will see basically healthy cartilage in between. All right, that's the blue strip that you see in here. Of course, you will see basically the whole knee itself. You see the ligaments at the side that is actually keeping everything in place. Now, osteoarthritic knee, you'll see that the cartilage is actually being worn down, and as the cartilage starts to wear, then you get bone rubbing on bone, and that is what actually creates the effect of pains in the knee. How do we deal with that? How can we prevent this from happening in the first place? Now, one of the first thing that you need to do, need to know about is weight on the body. If you are overweight, if there's excess, weight itself, all right, automatically that can generally cause problems to the knee. All right, usually that can cause wear and tear. Now, if you're a person that is consistently exercising and doing a lot of strenuous exercise, it can actually have an effect on the knee as well. So we'll be looking at some foods that can actually help with inflammation today. Now, this video itself will be up and running for persons that would like to view afterwards. It can actually be, and you will see what you can use, what you'll be able to stay away from, so that you'll be able to prevent the event of osteoarthritis, right, or osteoarthritic knee itself. Right, so as we go along, you will see foods that will eliminate inflammation. Now, inflammation is basically used to help get rid of problems as well. Okay, so inflammation actually is important, but then there can be what we call chronic inflammation. Now, what can actually cause inflammation to take place? If a person, how is inflammation good in the first place? Usually in that case, if a person has, let's say, a swollen finger, it swells up, or if you bounce the toe, it swells up, right? It creates some fluid within the area. What is happening there is inflammation is starting to take place. If that goes back down within 2 or 3 days, then the inflammation basically would have subsided. If a person generally, if that goes on and it continues, usually a person would have what we call chronic inflammation. Now, osteoarthritis is like having chronic inflammation in the joint area of the knee. When that happens, the cartilage wears down. Some person may have ligament damage. We'll be talking about a treatment that can actually help with that as well too. All right, so you want to share this video, share this live, so the person will be able to learn today. All right, so you'll see different nuts. If you look closely at them, you'll see Brazilian nut, which is actually excellent for thyroid function, by the way. You'll also see almonds, which is anti-inflammatory. Actually, almonds is alkaline nut, which works very good for the joints and, of course, for the muscle as well too. Also is packed with proteins, which can help a person to overcome things like protein deficiency. And then if you look at things like spinach, well, greens, natural greens, the foods that you're eating, either kale, spinach, broccoli, lettuce, all of that has anti-inflammatory properties. Tart cherries is excellent, especially because it has a lot of vitamin C, which vitamin C helps with inflammation as well too. And then we have olive oil, or raw olive oil does help with inflammation. Person that having knee pains, you can take basic olive oil and you can use a little cayenne pepper. So a teaspoon of cayenne pepper, a tablespoon of olive oil, you make a nice little paste. You can rub it on that knee that is having that pain. Oranges and vegetables. Now, oranges, naturally, because of the citric acid, it will cause pain. But it's actually used to help to rid the body of inflammation as well. So while it is that it may cause a little pain, it can contribute to helping rid inflammation. Pineapple is also excellent for a person who has inflammation. Now, if you notice, most fruit, most vegetables help with inflammation. But if a person already have chronic inflammation, sometimes the citric acids will contribute to causing pain for that person. So that's why limes and oranges, sometimes grapefruit for some persons will actually cause pain. So you look also at the type of foods, all right? So processed meat and dairy generally causes inflammation. Any type of soft drink will cause inflammation. Fast food If you're frying foods with high levels of omega-6, that will be oils like corn oil and soybean oils, as you can see them at the top of the inflammation list that will cause inflammation. Safflower oil, sunflower oil, soybean oils, corn oils, all of them will, as you put them through heat, it's going to cause inflammation. And fried foods. So as we go further down the list of inflammation, there are certain types of foods that you can use. Calcium from things like cruciferous vegetables that will actually strengthen the bones, the muscle, and even the heart health. So I'm giving you a little idea of nutrition itself. They'll also basically eliminate things like excess estrogen, carcinogens, also help with things like cancer. So although we're talking about knee issues, you'll see these different types of foods. There's also what you call anthocyanins, with to prevent like boost health, boost inflammation as well too. As you go straight down to the list, you have the fiber that become the peas and beans. They are also excellent sources to help to decrease inflammation. And as we look at the different types of foods, the berries, the corellas, all of that will help to fight inflammation, prevent different types of health complications as well. Look at these nice, lovely foods. So we're not going to be too long on this live. So I'm just going to give persons a little idea of what they need to eat, what they need to stay away from. And then we'll stay on just maybe for a little 2 minutes again, just to share some information on persons who have been dealing with common problems. All right, so best anti-inflammatory substance is water. Water actually works really excellent. Once a person has inflammation, you have to include water in your diet, into your lifestyle. If you don't drink enough water, inflammation level goes very, very high. All right, it's important for the knee. So we're just starting, so it's just going to be a quick review this morning. Now, ginger is excellent for persons that are having knee pains, back pains, hip pains. We're just dealing with the knees, so you can use about 1 inch of ginger. You make a tea with that, and that you're going to use basically that like twice daily. I'll also give an anti-inflammatory recipe when we come back on another program. Now, at the clinic, we offer treatment called prolozone. And prolozone therapy, if you look at this particular picture, this will be a knee. Okay, so that's the before picture. You'll see where there's bone on bone, and then after the therapy, then you'll see a little cartilage regrowing in the area. Of course, it takes time to do that. All right, to get a person back on track when it comes to knee problems. So prolozone is excellent for persons that are having knee, the cartilage which would have been worn out. Let me just give you a little idea of what prolozone is about. All right, now of course there's long-standing evidence, about 4 decades of clinical use of things like ozone. Now, ozone is basically what is used in prolozone. Prolozone contains ozone, B vitamins, minerals, nerve blocks. It's actually a very simple therapy, but it's a therapy that actually works pretty good for persons that are having pains in their knees. All right, so for ozone, of course, used on many diseases, especially treating musculoskeletal disorders such as knee osteoarthritis. Ozone is able to inhibit inflammatory cytokines. It's also basically work good on increasing nitric oxide, which helps to increase blood flow, stimulates anti-inflammatory cytokines, growth factors, right, chondrocytes, and also stem cells within the area of the knee. Now, stem cells is what is actually needed to help to regrow cartilage. Naturally, you don't get a regrowth of cartilage because it has a very poor blood supply. But with the use of ozone, with the use of minerals, vitamins, once there's cartilage, once you can stimulate what you have already, by God's grace, you'll be able to see the before and after picture that you have up there. Okay, now I just want to go back up a bit just to look at some of the different foods again that can cause inflammation. So as we talked about them, we looked at basically things like gluten, casein, which is from milk, processed meats, the different types of oil, vegetable oils. If you have to use oil, you're permitted to use a little olive oil and maybe a little coconut oil. Fried foods, meats, and dairy tend to cause inflammation, and they can have an effect on affecting the cartilage as well. Right, so that's just a simple explanation there. I know some person might not have been able to get the full program, but you could always look at it afterwards again and share it with your friends, share it with those that are close to you. Right. So by God's grace, hope that all goes well. If anybody has any particular question that they would like to ask, you can do that as of now. So just going to be on just for about 5 minutes again, and then we'll be closing off this live. So you can get this live on YouTube again later on. You could also, of course, get it on Facebook as well too. Okay, thank you for joining me today. Right, so this live is going to actually be ending now. Thank you. If anybody has had any questions, you could always feel free to call us on our numbers.